And in summary, we talked about resectable mesothelioma. If surgery appears possible, do a staging workup, establish what type of histology it is. You can do a pleurectomy and decortication for palliation, basically removing as much of the disease surgically as possible, and then radiate all the port sites and the chest cavity. If a patient goes to have an EPP or an extrapleural pneumonectomy, you can give radiation following that EPP, and then you can consider induction chemotherapy, which is chemotherapy prior to any radiation or surgery, but this isn't standard of care at this time. For unresectable mesothelioma, frontline therapy for chemotherapy is your cisplatin and pemetrexed doublet, or carboplatin pemetrexed or pemetrexed alone. And for second line, there is no standard therapy at this time, and consider clinical trials or a gemcitabine-based treatment plan. Any questions? Yes. Oops, sorry.
Okay. Can you tell us a little bit more about side effects and how you recommend patients deal with that, those many different side effects that we have?
There's not, do you want me to go back to the slide? Would that be helpful? There's not a lot of ways to deal with the side effects. You basically just treat them as they come. The biggest side effect is the neutropenia, which is very difficult to prevent. Good nutrition is the best way. Your risk of infection is high, so you want to stay away from large crowds when you have received chemotherapy, especially after day 7 of your chemotherapy till about day 15. That's when your bone marrow suppression starts to really go down. And actually, bone marrow suppression goes up, so your white cells and red cells go down, so your risk of infection is very high during that time.
What have you seen for patients that made them be more successful dealing with the side effects? Have you seen any?
I think good nutrition has been the best thing, because you get a little bit of nausea, you don't feel like eating. That's going to depress your normal body function to repel any diseases, viruses, bacteria. Your natural defenses are down when people stop eating normally. I think the best thing people can do is a good diet and try to stay as active as possible. Believe it or not, just keep your activity going. If you are having problems sleeping because your activity isn't that great and you're taking multiple naps during the day, and I always recommend just sit by a sunny window. If you don't feel like going outside, just do something to kind of stimulate your natural barriers to infection.